king of the forest and you could create the perfect healthcare system to meet the modern challenges, what would you design? What are some key elements?
So if I was, I want to be king of the jungle because I'm a Caribbean guy.
Okay, all right.
But if I could be king of the jungle or king of the forest, I think what I would want to do is think about appropriating dollars a little bit differently, and start appropriating dollars upstream more than on the downstream. Downstream meaning medical care after something's happened, whether it's the diagnosis of cardiovascular disease or diabetes or a heart attack or stroke, and start pushing the dollars further up. And not just up to do primary care, but to do some of the public health kinds of things. Here's a public health intervention: indoor smoking laws. Indoor smoking laws have all kinds of positive impact. One, they reduce heart attack rates almost immediately from a cardiovascular disease perspective. Two, they make it more difficult for young people to find a place where they can start smoking, and that by itself will reduce in the long run the likelihood that a child will smoke. So that intervention has both an immediate effect and kind of a downstream effect. And you push further upstream, and we start pushing dollars into schools in a way that begins to find those school systems and those approaches that are indeed making a positive difference compared to others in terms of graduation rates and in terms of success of those children who are graduating, and reappropriate how the dollars are being appropriated as compared to today.
Well, for me, in education, what I'd like to see is universal school choice. Much like people talk about universal health care, I'd like to see universal school choice, because unfortunately, as you would surely say, where you live impacts your health, which I would say it's where you go to school that has a greater impact on your health, because you could live in a community but go to a school outside of the community, have a higher probability of going on to college, and therefore not change your address but change the circumstances under which you're educated and by extent increase your probability of being healthier. So I'd go for universal school choice, and I would do vouchers and scholarships, meaning that if there is not a school that would be considered public that you see to your liking, then the money that your family has put forward into the system through their taxes should come to that family so that they may be in a position to choose the best school for them. We can no longer hope that a couple charter schools, a couple magnet schools, and the willingness and or ability for a family to either lie or use somebody else's address or move to be the way in which we're going to hope to get more children from historically disadvantaged populations into better schools. We can't open up enough charters that are good, magnets that are good, those suburban busing programs that are good. We're not going to be able to do enough of that, but we are going to be able to say to a child and their family, if you're willing to drive 45 minutes up the road, we'll give you a voucher to go to a better school. We're not going to provide you with transportation, but if you want to get there, this is one way to do it. Until such time as we put children first, we will maintain the status quo, and the status quo will promise us that Black and Latino people will be undereducated and unhealthy. Until we're willing to change the status quo, which means we're going to put children before jobs, we're going to damn people by virtue of the fact that they were born into the wrong neighborhood in the wrong womb. Not because there's something wrong with that woman or that man, but because they don't have the resources to buy their way out of poverty, of education that they're forced into. So, for me, there needs to be a disruption of epic proportions. We've played around the edges for too long. We've opened up a couple charter schools here, a couple magnet schools there, a couple choice programs there, and it's gotten a couple kids out. I'm saying never again should a child have to participate in a lottery. How absurd is that? Never again should a child be forced to go to the school that's closest to their house, when there's a better school on the other side of that. And stranger, even still, because of zoning rules, the closest school may be just outside of the zone. And the closest school may be a better school than the one to which you're zoned. So you force a kid into failure because of some imaginary lines that are drawn to make sure that blacks and Latinos don't go to largely white schools. We don't think about the implications when we're creating these circumstances. What we do is we allow, and I say we because it's not just white people, it's people in general. We think that one group of people is a better class and therefore as a result should have better education and better life expectancy. We don't think about the long-term implications of these decisions. We're just making a decision for now. I don't want my kid to go to school with those kids, and so therefore this is our community schools. Not recognizing that as a country we suffer. Not one of us benefits from sending more and more children to failed schools. So where we are now is we've reached that critical place. There are entire cities that have virtually no good schools. And you hear people say, well, the teachers are working hard. Fantastic. Awesome for them. The principals give all they have. Wonderful. No results. You wouldn't hear someone say that you could only go to the cardiovascular surgeon who's in the hospital closest to your house. So why then is it that you can only go to the science teacher who is closest to your house? In both cases, we need to open up the systems to provide greater access for all, because we all benefit from having better educated, healthier people of all colors.